Okay, anyways. Okay, I just cut my finger, so, ow. But I'm okay if I blow on it. Anyways. So he said, "You're beautiful, cute, adorable." Whenever I literally almost broke my finger with a kitchen knife.
Is here with the details. Elizabeth. Brianna, U.S. health officials are saying that the CDC is considering shortening the quarantine time. Right now, it's 14 days, but the CDC is thinking about whether it should be maybe 7 to 10 days instead. But there is a big if here, and that if is if you get tested at around that 7 to 10 day mark, and that test is negative, then your quarantine will be shortened. The CDC is still thinking about this. They say that it's a new virus, and new information is coming in all the time that would tell them what length of quarantine is the best. Brianna?
All right, Elizabeth, thank you so much for that. I want to turn now to a member of the President-elect's Coronavirus Advisory Board. Rick Wright was a top vaccine expert, still is a top vaccine expert, but he then turned whistleblower and resigned from the Trump administration after he said he was sidelined for criticizing the pandemic response. Rick, thanks so much for being with us. There's a new study that could not find one instance of live virus beyond the 9th day of illness. Another study found a woman who was infectious for 70 days. So how do experts navigate the quarantine time on considering these data points?
Brianna, thanks for having me on again today. This is really important news and new data that we're finding. As you mentioned earlier, we're learning something new about this virus every day. It's really important that when people know that they're infected with this virus, that they do everything they possibly can to not spread it to others and infect other people. So we need to really understand how long a time is necessary for them to quarantine or isolate interaction with other people. We don't want it to be any longer than it has to be naturally, so people can get back into their life and their schedule. So naturally right now we're looking at a 14-day quarantine, but we are getting more data that shows that most people are infectious or spreading that virus in the first 9 days after their exposure. And so if we can learn with enough data that after a 9 or 10 or 12-day window is sufficient to no longer spread it to other people, then maybe there is an opportunity to reduce that quarantine time. In the meantime, though, I do want to repeat the message that it's critical that we follow those public health guidelines that are available today from the CDC. And wearing our face mask right now is the best way, no matter what time it is or when you're infectious, to stop from spreading that virus to other people.
Okay, I want to talk to you about what we're in the middle of, which is Thanksgiving tomorrow, and there's a lot of people who they've already traveled, they're going to be traveling, there is no CDC guidance that's going to stop them. Okay, so let's talk about those people in a second. But there are people who are staying put, they're following the CDC guidance, but there's going to be a surge after Thanksgiving. So should people basically shut down following Thanksgiving as they wait to see what's happening in their communities with the virus? What should people do?
You know, we're in probably the biggest peak we've seen so far of this virus and the outbreak and how many people are getting infected, and they're breaking records every day. So the only thing that we know right now to stop the spread and bring down that curve is for more people to follow those public health guidelines, for more people to wear your mask and socially distance and wash your hands frequently. For those people who stayed home and didn't travel and are following those guidelines and keeping your groups very small for the holidays, we are very grateful for you for following those guidelines, and